All right, well, good afternoon, and thank you for joining Public Health for today's media briefing. Dr. Ferrer will make comments and followed by a time of answering your questions, and then we will make remarks in Spanish. Spanish remarks will begin at about 2:30 today. If you want to be put in the queue to ask a question, click on the hand icon, which you can find in the participant panel, or you can send me a chat. I'm the host. So with that, we'll turn things over to the Director of Public Health, Dr. Barbara Ferrer.
Thank you, and thank you for joining me for today's briefing. This afternoon, I'll be talking about our trends in cases, hospitalizations, and deaths by vaccination status and age group. I'll talk a little bit about what full vaccination means with regard to COVID transmission. We have some updates from a small social behavior study that I will share with everyone. We'll, as always, review our progress on getting more people vaccinated. And we'll take a look at recent local, state, and federal policies directed at increasing vaccination and safety. We'll start with the daily numbers. I'll take the first slide. I'm sad to report 23 additional deaths today. At least 20 of the people who died had underlying health conditions, and this does bring the total number of deaths to 24,739 in LA County. To everyone who's lost their friends, their loved ones, and their family members, our thoughts and hearts are with you, and we wish you comfort and peace during this most difficult time. We're reporting 3,865 new cases today, bringing the total number of cases in LA County to 1,339,138. Our daily average case rate with a 3-day lag is now 27.8 cases per 100,000 people. That's a 32% increase from last week's same day rate of 21 cases per 100,000 people. To date, nearly 7.6 million people have been tested and had test results reported in LA County. I do want to note that as our businesses, schools, and institutes of higher education are putting back in place or setting up routine testing screening programs, we expect to see hundreds of thousands more test results each week. And in parallel with that big an increase, we're bound to see increases in cases. Our daily test positivity rate is 4.5%, and that's a slight decrease from last week's same day rate of 4.7%. There's 1,761 people currently hospitalized with COVID-19. This is a significant increase of 482 people over the past week. There are currently 269 open investigations at residential congregate settings and non-residential settings where there's at least one confirmed case of COVID-19. We can go on to the second slide. In order to assess the risk of COVID in LA County, we use the CDC indicators and thresholds to categorize community transmission of COVID-19. You'll note that on this table, the CDC is using a cumulative 7-day case rate, meaning that they're looking at the number of cases per 100,000 over the past week, rather than a daily case rate. So we're going to also present our data the same way. Transmission in LA County remains at a high level. Our 7-day cumulative case rate is now 195 new cases per 100,000 residents. And that represents a small increase, about 15% from last week. We can go on to the next slide. This graph shows us the trends. We'll take the next slide. Thanks. This graph shows the trends in cases, hospitalizations, and deaths in our county from the beginning of the pandemic through August 4th of this year. Cases are represented in the green trend line, and we've been reporting an average of more than 3,000 cases a day for about the past week. As I've noted, we expect to see these numbers rise with increased testing. Hospitalizations have also recently begun to rise more steeply. For the past few weeks, I've been sharing with you that cases have been increasing at twice or more the rate of hospitalizations. However, comparing August 4th with July 4th, we see cases and hospitalizations rising at similar rates. Over that period, cases rose by about 387%, and hospitalizations rose by 366%. This alarming increase in the rise in hospitalizations serves as a stark reminder that this virus causes debilitating and dangerous illness among many who are infected. The percent of positive cases requiring hospitalization now rose to 8%. And while the number of people dying from COVID remains relatively low, our 7-day average number of deaths is now 7, and that's higher than the average of 4 to 5 that we were seeing a month earlier. These losses are particularly sad, given that we have so many strategies at our disposal to prevent them. Next slide. The surging numbers reflect the reality that the Delta variant now accounts for nearly all of the COVID strains seen among samples sequenced in the LA County area, last week comprising 99% of all sequenced strains. And that's as indicated on this blue line you can see on the graph. As we know, the Delta variant is more efficiently transmitted between people, likely due to its faster replication, excuse me, higher viral load, and greater affinity for lower respiratory tract cells compared with the earlier COVID strains. And while emerging data affirms that fully vaccinated people are well protected from severe infections with Delta variants, it's now clear that fully vaccinated people can become infected, and if infected with Delta, they can infect others. We've also been getting some questions about Lambda, the Lambda variant. This is the predominant version that's circulating in Peru. Because this variant has some similar features to Delta, it was recently declared a variant of interest by the World Health Organization. We've only seen one Lambda sequence from specimens in LA County labs, and this was from a sample that was collected in June. We will continue to monitor lab data for changes in the variant population, and as always, we'll share that with you. Given that the Delta variant is more easily spread and hospitalizations continue to rise, common sense precautions are appropriate, and adding in extra layers of protection makes the most sense. This includes masking, distancing, and avoiding very crowded settings as much as possible. Unvaccinated people need to be particularly careful, and they should avoid high-risk activities and wear respirators, that's N95 mask or a KN95 mask, if their work or an activity requires that they'll be in very close contact with others. We can go on to the next slide. Given the increased evidence that fully vaccinated people are getting infected, we do continue to share information each week on the vaccine's effectiveness and how to use this information to best keep ourselves and others safe and to get back to slowing transmission. This slide shows data for those fully protected by the vaccines to scale. The large green box represents the 5.1 million residents that are fully vaccinated. The tiny purple box in the left lower corner of this box represents the 21,532 fully vaccinated people who have tested positive for COVID as of August 10th. This is an increase of about 37% from last week. Of those who tested positive, now 549 have been hospitalized, and that's again up from last week slightly. This translates to an increase from 0.009% to 0.01% of all fully vaccinated people ending up hospitalized. Deaths in this group over this interval also increased slightly, and now we've gone from 41 deaths to 55 deaths for people who are among people who are fully vaccinated. This takes us from 0.0008% to 0.0011%. These small increases provide proof that fully vaccinated people are becoming infected, and that with these very high rates of community transmission, more fully vaccinated people are getting post-vaccination infections. However, this data should also provide significant reassurance that fully vaccinated people remain at relatively low risk for becoming infected, still below 1%, and even lower risk for having a bad outcome if they are infected. We can take the next slide. We see the advantages of vaccination most clearly when we compare COVID outcomes between vaccinated and unvaccinated or partially vaccinated people. In this and the next few slides, I'll be sharing data comparing cases, hospitalizations, and deaths among fully vaccinated and non-fully vaccinated residents of LA County, with additional breakdowns by age groups. In all of these slides, case rates among unvaccinated people are represented by orange lines, while rates among vaccinated people are in green. Rates in adults between the ages of 18 and 49 are represented by solid lines, and rates in adults aged 50 and over are represented by dashed lines. All of these trend lines begin on May 1st, and as you can see, our current wave of cases began in late June. Case rates differ considerably, both by vaccination status and by age group. The highest rates of cases are among unvaccinated or partially vaccinated adults between the ages of 18 and 49, and that's represented by that solid orange line. The next highest case rates are among unvaccinated or partially vaccinated older adults, represented by the dashed orange line. And below them, vaccinated younger adults in the solid green line, as you can see, have lower rates, and those that are over 50 have the lowest rates of all who are fully vaccinated. We can take the next slide. I know as we're all sending children back to school this month, people are anxious for good information on what we see about cases in children under 18. Here you can see about a 4.5-fold difference in the case rate between vaccinated children, represented by the green dotted line, and unvaccinated children, represented here in the orange dotted line. You'll note that among the unvaccinated cases represented here are children under 12 who are not yet eligible for vaccines. It's to protect these children and their families in particular that schools and districts are working so hard to get safety protocols, including widespread masking and testing in place. You can go to the next slide. When we look by age group at who's now getting hospitalized, we can see that the highest hospitalization rate is among older unvaccinated adults, and that's represented here by the dashed orange line. For those over 50 who are unvaccinated, there's been a 240% increase in hospitalizations since July 3rd. These are our highest risk residents because of their age, the likelihood that they may have comorbidities, and the lack of vaccine protection. And sadly, as you can see, hospitalizations in this group are rising very quickly. Hospitalizations in younger unvaccinated adults, represented here by the solid orange line, are also rising. The increase in cases, hospitalized cases among younger unvaccinated adults, is now 237% since July 3rd. Relative to unvaccinated adults, hospitalization rates among vaccinated adults of all ages remain very low, and vaccinated patients in July comprised 13% of patients hospitalized with a positive COVID test. Trend lines are like these that we show regularly are why we feel so certain that the vaccines are doing exactly what they're supposed to be doing here in LA County. Vaccinated people are exceptionally well protected from hospitalization. And while we have seen cases rise among vaccinated people and hospitalizations rise, it is hard to even draw a comparison between the experience they have of COVID and the severe illness the infection continues to cause among those unvaccinated. This slide presents perhaps the most clear-cut data we have to demonstrate the effectiveness of the vaccines. Almost all COVID hospitalizations and deaths are preventable with just this one prevention strategy. If everyone eligible were to get vaccinated, there wouldn't be so many families dealing with the worry of having a loved one hospitalized with COVID. We'll go on to the next slide. The difference in hospitalization rates for vaccinated and unvaccinated children is even more dramatic, although the numbers in children are very, very small. This means that the hospitalization rate for unvaccinated children is still low. It's less than one hospitalization for every 100,000 children. Nevertheless, this is much higher than the virtually non-existent hospitalizations among vaccinated children, and that's represented by the green dotted line. It's important to note that included in this orange dotted trend line are all of the unvaccinated children under the age of 12 who are not yet eligible for COVID vaccines. We can go on the next slide. We have begun to see a small upward trend in deaths whose timing suggests it's attributable to the infections that were acquired during our recent rise in transmission. After hovering at the rate of about 2 deaths per 100,000 people per week, our death rate in unvaccinated adults over 50, indicated by the dashed orange line, began to rise in mid-July, and now it's just slightly below 4 deaths per 100,000 people. Meanwhile, the death rate has remained nearly flat, even in unvaccinated young adults and in all vaccinated adults. This information is a stark reminder that almost all COVID deaths are preventable with the vaccine. We can go on to the next slide. This chart shows the differences in case, hospitalization, and death rates between and among pediatric age groups. Note that there's no vaccinated comparison group for children in between the ages of 0 and 4 and 5 to 11, because these groups are not yet eligible for COVID vaccines. In the two younger age groups, the case incident rate is between 200 to 300 per 100,000 children. Mirroring trends that were present earlier in the pandemic, the hospitalization rate, while very low for all children, is substantially higher for the youngest children, age 0 to 4. The case rates among unvaccinated 12 to 17-year-olds is 457 per 100,000. This is nearly 7 times that among their vaccinated counterparts. And while there are virtually no hospitalizations in vaccinated children in this age group, the hospitalization rate amongst unvaccinated 12 to 17-year-olds is 3.1 hospitalizations per 100,000. Clearly, vaccines are working to prevent cases and hospitalizations among our teens. Meanwhile, case rates are higher among all 18 to 29-year-olds. However, here again, the difference between vaccinated and unvaccinated young adults is significant. It's threefold. And tragically, unvaccinated 18 to 29-year-olds are nearly 50 times more likely to be hospitalized than their vaccinated counterparts. Altogether, these data suggest that while younger children are generally at lower risk for hospitalization due to COVID, without vaccination, many more children would be hospitalized for this infection. Additionally, even with very high rates of infection among young adults, vaccination is extraordinarily effective at keeping young adults out of the hospital. We can take the next slide. If we look at these same outcomes among younger adults and older adults in these two age groups as of July 31st, you can see that the highest case rates are again in younger adults between the ages of 18 and 49, with a rate of 429 cases per 100,000 people, and that unvaccinated adults in both age groups are about 3 to 4 times more likely to become infected than their vaccinated counterparts. Even when we define younger adults more broadly, as we did here, to include adults up to 50 years old, we see that unvaccinated adults in this age group are 24 times more likely to be hospitalized than vaccinated adults. Older unvaccinated adults over 50 are hospitalized at a rate of 42 hospitalizations for every 100,000 people. And this is they're nearly 11 times more likely to be hospitalized than their vaccinated counterparts. And if you look at the differences in death rates, unvaccinated adults ages 18 to 49 have a death rate of 0.3 deaths per 100,000, but there are virtually no deaths in vaccinated members of this age group. Meanwhile, adults over 50 who are unvaccinated are 42 times more likely to die as a result of COVID than their vaccinated counterparts. So again, what we see is broad protection from the vaccine against all outcomes in all adult age groups. Next slide. I'm just going to look quickly, just to show the trend lines. These are overall age-adjusted case rates by vaccination status. And what we've been talking about, for the last few weeks is clearly seen here that cases are rising faster and higher among unvaccinated people. Unvaccinated people are currently 3.6 times more likely to be infected than vaccinated people. The case rate in unvaccinated people is 243 cases per 100,000, and that compares to 66 cases per 100,000 in vaccinated people. We'll take the next slide. We're able to look at the overall age-adjusted hospitalization rate by vaccination status again over time. And here you see hospitalizations rising faster and higher among unvaccinated people, that's in orange, than among vaccinated people, That's the line in green. Unvaccinated people are currently 14 times more likely on average to be hospitalized than vaccinated people. The hospitalization rate for unvaccinated people here is 15.8 hospitalizations per 100,000. That's compared to 1 per 100,000 in vaccinated people. We'll take the next slide. I do have a little bit of data I wanted to share from a small cohort study that describes differences in behavior between vaccinated and unvaccinated people in LA County. This data is from a cohort study that's conducted by the University of Southern California in collaboration with the Department of Public Health. And it follows over time a group of about 1,200 adult residents that are demographically and socioeconomically representative of residents across the county. About 90% of this group is fully vaccinated. Over a month spanning June to July of this year, members of the cohort were asked whether over the past week they had engaged in a variety of activities or behaviors that increase and/or reduce transmission risk. Their answers are presented here, sorted by the vaccination status of the respondent. We found that a higher portion of unvaccinated people engaged in activities that increase transmission risk, including going out to bars, clubs, or other gathering places, going to other people's residences, attending large gatherings, and taking mass transit. Meanwhile, we found that a higher proportion of vaccinated people engaged in activities that reduce transmission risk, including following government rules to limit contact with others, wearing a face mask when in the presence of other people, remaining at home as much as possible, avoiding large gatherings of more than 50 people, not shaking hands, and generally avoiding touching people as much as possible, and when possible, being able to work from home. Although none of these activities were restricted during the period over which these behaviors were assessed, and the number of survey participants, as I noted, is relatively small, it is concerning to see trends suggesting that in this cohort, those who were unvaccinated were engaging in activities that could easily lead to more exposures. The work in front of us is to be sure that folks who are engaging in higher risk activities know that by taking just one action, and that is to get vaccinated, even if they make no other change in their lives, they are at least protected from a severe outcome that could result from an exposure to COVID while out and about. We'll take the next slide. I do want to talk for a minute about what it means to be fully vaccinated in the context of the wide circulation of the Delta variant. As we've seen, vaccination means that you're much less likely to get infected with COVID, almost 4 times less likely on average. People who take the additional step of routinely wearing well-fitting masks when around people outside their households are even less likely to get infected, while people who take more risks, either voluntarily or because they're working in higher risk settings with lots of sustained close contact with others, may be somewhat more likely to get infected. Regardless of the level of risk, being vaccinated also means that if you do get infected, you're much less likely to get severely ill or die. According to the data we just showed you, vaccinated people are about 14 times less likely to be hospitalized on average than unvaccinated or partially vaccinated residents. We are seeing early signs that among vaccinated people who do get infected, those most likely to end up in the hospital are people with chronic illnesses and weakened immune systems. So for everyone who is vaccinated, taking an extra step of layering a mask on top of vaccinations is particularly important. And this is especially true for people with chronic illnesses and/or weakened immune systems. We hear from a lot of fully vaccinated people who aren't sure what they should or shouldn't be doing during this time of high transmission of a very infectious variant. While there is clear evidence that risks are significantly reduced for vaccinated individuals, they are not eliminated. So common sense precautions are warranted by everyone at this time, in part because fully vaccinated people infected with Delta can transmit the virus to other people. So even if you're fully vaccinated, use caution in crowded and indoor settings, especially around unvaccinated people outside your household. And remember that distancing and masking always add a layer of protection. If there are people in your household that cannot be vaccinated, You may want to take extra precautions when you are among people outside your household and assess how much risk there may be at events or activities you're planning to attend. And as a reminder, any fully vaccinated person that has symptoms of illness and/or a known or probable exposure to COVID should always get tested. And while waiting for the results from testing, you should remain isolated from others. We'll go on to the next slide. This week, as everybody has heard, the Centers for Disease Control and Prevention and the Food and Drug Administration have taken or are expected to take steps to expand the protections offered by vaccines. Yesterday, the CDC released new data from a study of 2,500 women who were vaccinated before 20 weeks of pregnancy. The study found no increased risk of miscarriage in this group, and in combination with previously shared data that showed no pregnancy safety risk with late pregnancy vaccination, this information is affirming the vaccine safety in all stages of pregnancy. Meanwhile, there's mounting data that shows that COVID infection increases the risk of severe illness and pregnancy complications for those that are unvaccinated. In light of these findings, the CDC now recommends vaccination for all pregnant women. If you're pregnant, you can get vaccinated at any of the county or city sites without an appointment. And please visit our website at vaccinatelacounty.com for location information. Today, the FDA is expected to amend, I believe they already have, their emergency use authorization of Pfizer and Moderna vaccines to allow people with compromised immune systems to get a third booster dose of the vaccines. This recommendation is based on several studies that showed that people on immunosuppressive medications develop low or no levels of protection after 2 doses of the vaccine. The CDC's Advisory Committee on Immunization Practices could vote on recommending third doses to immunocompromised people as early as tomorrow. We'll be working with the state to prepare for implementation of this change as quickly as possible. We can go to the next slide. Given the high rate of community transmission, our vaccination efforts remain critically important to reducing the impact of rising infection on our residents. As of August 8th, as you can see, we've administered more than 11.3 million doses to residents 12 and older. This includes 6.3 million first doses and more than 5 million second doses. If you go on to the next slide, you can look at our vaccination efforts by specific age groups in LA County. As of August 8th, we vaccinated 89% of LA County residents 65 and over. 73% of residents 16 and over are vaccinated, 72% of residents 12 and over, 63% of residents 12 and over are fully vaccinated. Of LA County teens between the ages of 12 and 17, 56% received at least 1 dose and 44% are fully vaccinated. So if you look at out of our nearly 10.3 million LA County residents, and this includes everyone who's not yet eligible for the vaccine, 62% have received at least 1 dose and 54% are fully vaccinated. Next slide. We did see a slight plateau in our vaccination efforts this past week. Between August 2nd and the 8th, we administered about 86,000 doses across the entire county network. This is down just slightly from the previous week. While we are immensely grateful to everyone in this county who's already vaccinated, those of you who recently got vaccinated, since we still need to get as many residents as possible vaccinated as fast as possible, increasing this weekly number is one of our top priorities. We can go on to the next slide. We can take a look as well on closing some of our vaccination gaps, because we do have, as you can see, a lot of variation between age and racial and ethnic subgroups. But we are continuing to see some increases scattered among groups with lower vaccination coverage. The numbers on this slide are now color-coded to show which subgroups are still vaccinated at proportions lower than 50%. Those groups that reached 50% are in red. Unfortunately, that's most of this grid, while the remainder are in white. As you can see, our Black young adults and both Black and brown youth are still vaccinated at very low rates. Persistent transmission places our least vaccinated populations at highest risk, and increasing the levels of vaccination among our Black residents and other teens and young adults is essential to closing the gaps in case, hospitalization, and death rates. And while we continue to ensure access to vaccines and accurate information about safety and effectiveness of the vaccines, the threat to our collective health and well-being remains high until vaccination coverage is improved. We'll go on to the next slide. And as a consequence of the urgency presented by the increasing high case numbers, multiple policies have been announced over the past week with a goal of increasing community safety by increasing vaccination. I tried to highlight these recent policies on this chart. First is the executive order issued on August 4th by LA County Board of Supervisors Chair Solis, which requires that all LA County employees provide full proof of vaccination by October 1st of this year. On August 10th, the Board of Supervisors passed a motion directing public health and other agencies to report back within 14 days on options for requiring vaccines at certain indoor public spaces in LA County. We've been instructed to consider whether a mandate should require one dose or full vaccination, and to consider whether a vaccination policy should apply to all indoor public spaces or only to certain non-essential businesses and events. We've also been asked to explore the process for how people can prove vaccination status and how businesses can verify vaccination status using either digital or paper records. Yesterday, the state issued a health officer order applying to all public and private K-12 schools, indicating that these institutions must verify the vaccination status of all paid and unpaid employees. This order mandates that unvaccinated workers must be tested at least weekly, and there's to be full compliance with this state health officer order by October 14th. And finally, we're issuing a health officer order today requiring that healthcare workers working in LA County must be fully vaccinated by September 30th of this year. This order aligns with the state order and applies to volunteers, contractors, and students, in addition to all part and full-time employees at our healthcare facilities. The county order also includes emergency medical technicians and paramedics, dental office workers, and home health workers. Exemptions to this requirement will be allowed only for qualifying medical or religious reasons, and exempt workers must be tested once or twice a week, depending on the type of facility in which they work. Additionally, exempt workers need to wear respiratory protection at all times in the form of either medical grade masks or respirators. We do gain a new understanding just about every day about how the Delta variant is spreading. Much of what we're learning affirms that it spreads more easily, and this is why we need to move swiftly to improve vaccination rates. The evidence continues to show that vaccines provide the most excellent protection against the severe outcomes from Delta infection, and that the same sensible precautions that protected us from earlier strains of COVID are still very effective against this latest strain. We're fortunate that we have the tools at hand that we need to get back to slowing the spread of Delta. We'll all just need to accept that as the virus changes, we need to be flexible in our responses to reflect the changing science. Next slide. And as we apply what we're learning about the virus, we need to adapt our lifestyles so we can keep ourselves safe and well, both physically and mentally. For so many of us, that means continuing to spend time going out and doing things we enjoy with people we care about, while taking sensible steps to keep ourselves and them safe. The best way, obviously, to do this is for everybody who can to get vaccinated. Even one shot provides some protection while you're out and about. And when you're fully vaccinated, you can feel confident that if you do get exposed to COVID while you're out having fun, you're unlikely to get seriously ill. Gathering outside allows for natural breezes and airflow to more quickly move any airborne viruses past our noses and mouths, reducing the risk of transmission. So wherever you can take your gathering outside, do. Spreading out and keeping some physical distance between people at a gathering also can reduce spread. Of course, when you're out, eating and drinking are part of the fun. and you probably have to remove your mask to do both of these things. Staying seated while you eat or drink helps reduce the risk that you'll unwittingly transmit infection while you're unmasked. And when you're not eating or drinking, you could keep your mask on, especially if you're indoors or you're in crowded outdoor spaces. We're glad that our businesses are open, and I know you're all glad as well. And the best way to keep everyone open is to ensure that they are safe places where people are gathering. So please follow the health officer order requirements on masking, any specific requirements at individual establishments, and the common sense recommendations we outlined above. Go on to the next slide. We know that many are attending sporting events, concerts, and theater productions at large venues. As a reminder, at large indoor events in LA County with more than 5,000 people, attendees are required to show proof of vaccination or a recent negative COVID test at entry, and everyone must wear a face covering while indoors, regardless of vaccination status. For those attending outdoor mega events with more than 10,000 people, face coverings are required when inside concourses or at other indoor structures, including restrooms, retail stores, and restaurants. We're also strongly recommending that everyone, particularly those that are unvaccinated, keep their masks on when in large crowds where distancing isn't possible. I want to thank all of the smaller businesses and event establishments that are implementing safety recommendations, including requiring attendees to be vaccinated and layering masking and distancing as appropriate. These efforts make it a lot easier for us to enjoy the activities that we love. Thank you, and I'll now take your questions.
Our first question will come from the line of Patrick Keeley with NBC News.
Hi, Dr. Ferrer. I wanted to ask you about the trend in case rates, which sounds like it went up significantly depending on whether you look at 3 days or 7 days. Does that kind of shake your hope from last week that the surge is starting to level off? And one more question, if I may. I want to double check I understood you correctly that on the deaths between the unvaccinated and vaccinated, that the number of deaths among the vaccinated went up 14 in 1 week. Is that correct? And should we be alarmed that it was that high? Thank you.
Yeah, thanks so much, Patrick. Let me go to the last question first. As a reminder, when we report deaths, sort of this week, it includes deaths that have happened, over a longer period of time. It's just when they get reported to us. And sometimes those are deaths that, occurred, 2 weeks ago or 3 weeks ago that are just getting identified as a COVID death. So I want to just a little bit of caution on the interpretation of that somewhat large increase in deaths among fully vaccinated people. So again, that all requires a lot of matching, and it is not true that all those deaths occurred this past week. But because of that, we try to sort of go back over time and really look at how many deaths are we seeing each day from people who are passing away from COVID, and those numbers, as you know, are significantly smaller. But thanks for giving me an opportunity to clarify that. Nonetheless, overall, more deaths with lots more transmission and lots more hospitalizations. And is the surge leveling? I do want to say, sort of the good news continues to be that when you compare what's happening in LA County with the rest of California, we have a much slower rate of increase still. And, in part, it's not at this point really fair to use the word leveling. What we're seeing is that the increase is not as, it's not increasing at the same rate as it was, and that is good news. But we did see, I think overall it was about a 15% increase from last week in our case numbers. Part of that, as I noted, is attributed to a lot more testing. But that, when I say it that way, some people say, oh, that means we shouldn't worry about it. And that's not what I'm saying. These are real cases and they get identified, and that's good. We want there to be a lot of testing to identify cases. We want people who are symptomatic to go get tested. We're in favor in many of these venues, particularly where there are large numbers of unvaccinated people, for there to be this routine screening testing. It gets us to an ability to find those asymptomatic folks who may be carrying this virus earlier, and we can, in fact, go ahead and ask those people to isolate then and quarantine their close contacts. So it's a good strategy for reducing transmission overall and slowing the spread, but it will have the impact of increasing our numbers. So in part, that's what we're seeing. It still means there is a lot of community transmission going on, and we all need to take additional safety precautions. But thanks for that. And we can go on to the next question.
Next question will come from Stephanie Dazia with the Associated Press.
Hi, thanks so much, Dr. Ferrer, for taking the time. In regards to schools, do you believe that the weekly testing of non-vaccinated teachers and other school staff is sufficient to head off outbreaks, or if more frequent, like daily testing should be done? And do you also believe that students should be regularly tested? Thank you.
Yeah, it's a great question. And, we've been meeting, almost daily with different folks that are involved in creating a lot of safety at the schools. And one thing we've all agreed on is with this reopening, there's a great need for flexibility as we learn more about transmission in our school environments. The key here is layering on all kinds of different protection strategies. So, if it was just testing and that's all we were doing, then more frequent testing would actually be very sensible. But what we're doing here is relying heavily on people who are vaccinated, being vaccinated, and we're relying heavily on everyone wearing face covering when they're indoors, and on distancing infection control protocols as appropriate. So there's lots of different levels of safety that are being introduced in our school environment. Now, we've already been very clear that when there are outbreaks, and that's defined again as 3 cases over a 14-day period that have a link to transmission in that school environment. When we see that, our team's going to be working closely with folks at schools to assess what are the appropriate steps. I mean, one thing we know is that in those situations, it's likely that we require everybody, even if they're vaccinated, if they've been a close contact or had an exposure, to go ahead and get vaccinated. But if we are seeing, as you noted, a lot of outbreaks in some schools, we'll take a hard look at, whether or not that's happening, particularly in schools with lots of unvaccinated students. And does it then make sense to include unvaccinated students in that weekly testing? And in some cases, would we need to think about a different cadence? But these are decisions we're going to have to make as we move along. And, I'm so grateful for all of our district superintendents and staff, our labor partners, because I think there's just agreement that we do our very, very best. We're mindful that everybody has a part to play, parents, students, administrators, teachers, and staff, in creating these very safe environments. And we're going to learn exactly what other strategies may be needed as we go along. But I feel really confident that with the layered approach we've got, schools are opening with a lot of safety right now. So thanks for that.
We'll go next to Ron Lin with the LA Times.
Hi, Dr. Ferrer. Thanks so much for taking our questions. We have 2 questions today on children and one on the positivity rate. First, regarding children, there was a lot of chatter earlier this week on how rates of new COVID hospitalizations among children nationally are higher than at any other point in the winter surge, but that doesn't seem to be the case in California. Can you talk a little bit more about the situation in LA County? You seem to suggest that while hospitalization rates are slightly rising among children, they're still very low. Second, it looks like the hospitalization rate among, as you pointed out to the Board of Supervisors, among unvaccinated children ages 5 to 11 are on par with vaccinated young adults. This was surprising to me. Can you explain why that might be, and if that can provide some assurance to parents that they can safely send their children to school? And then finally, I get that cases and hospitalizations are continuing to increase, but how should we interpret the declining positivity rate? Is that a good sign, or is it meaningless because so many people are just getting tested now? Thank you.
Oh, yeah, thanks a lot. So yeah, I mean, our trend line looks different than what's being seen nationally, but I think the important, take home message is that there have always been children that have needed to be hospitalized with COVID illness. And therefore we all have to do our very best to layer in all of the protections, particularly for those younger children that can't get vaccinated. Obviously, we've also, had other strategies, here in California, and in some ways more stringent requirements than some other places that have protected everyone from what I call unfettered transmissions. So, I think that plays in with younger people and younger children as well as with older people. So I don't want to discount the safety measures, and I don't want to discount all of the work that parents and childcare providers and schools have been, really doing for a very long time now to try to offer a lot of protection for our younger children. In terms of sort of what we saw, where unvaccinated 5 to 11-year-olds had, I think it was, did you say it was a similar case? I think it was a similar hospitalization.
What I meant to say is hospitalization rate.
Yeah. Okay, great. Because I thought it was hospitalizations. Had a similar hospitalization rate to vaccinated young adults, and should we, be somewhat worried about that? And first of all, the number is super small for everybody, as I keep saying on hospitalizations. But also, what I think is important is that from what we can tell is the young adult rate, and I think I showed some of this today as well, for people who are vaccinated has significantly dropped. So, it's important to know that, some of what's driving that is not that a lot more children between the ages of 5 and 11 got hospitalized, but that a lot less children between the ages of 12 and 17 got hospitalized. And I showed that data today, that for vaccinated teens, there are hardly any hospitalizations. So I think that might be a slightly different way to look at it. I'm not sure if you saw those slides today, Ron, but maybe putting those together would help explain why that comparison happens and why it actually is evidence about vaccine safety. I know the looming question, that everybody is paying most attention to is, what does this mean for parents who are nervous sending their children back to school who cannot be vaccinated? And again, I'm hoping that, as we looked at all of the information, 3 things are standing out. One is that children are still much less likely, especially younger children, than adults, to end up getting infected. The other is that they have some of the lowest hospitalization rates, which means even when they're getting infected, they're still much less likely to end up with serious illness. And really, I mean, we've had tragic deaths, but a very small number of tragic deaths. I think it's 6 since the beginning of the pandemic for children here, because again, severity of illness is nowhere near as significant for children. And if you add that data with the fact that we're layering in a lot of protections in our schools, and although younger children can't get vaccinated, the older people around them can. And, what we're hearing is that there are relatively high rates of vaccination among staff and teachers at school. And wherever you have that extra protection that's coming from vaccinations, you've added a layer we never had before. So couple that with the masking requirements, with distancing and infection control as appropriate, I think parents can feel reassured that schools are creating as safe an environment as possible. Is it risk-free? Absolutely not. But we've heard for months now about the risks of not having children be able to return to school as well. So I think in this case, a lot of safety measures are in place. Parents should feel reassured that case rates are still very low amongst children. Serious illness still remains relatively rare. And if we all are doing our part, we're hopeful that schools are going to open with a lot of safety and without a lot of increased risk. past studies that, this is before Delta, showed that there was less transmission going on at our schools that were open. Remember, in the spring, we had a lot of schools open than what was occurring in the community. So we know that layering in protection can help, and we're glad that we have vaccinations that urge everyone who can and is eligible to get vaccinated. And your last question, the decline in test positivity, no, it's good news. I mean, it's not meaningless at all. If you had a lot more testing and test positivity went up, that would just say you've got a lot more transmission going on. If you have a lot more testing and test positivity remains flat or it declines a little bit, it means that community transmission is either stable or may in fact be declining slightly. I mean, none of these numbers say to me that, we've got a decline in community transmission. Test positivity is hovering at about 5%, and that's still pretty high. But with all this testing, it's not going up, which means that, we haven't really seen, and again, more explosions of transmission as we were seeing earlier during, I think the earlier parts of July. So thanks, Ron.
Great. Our final question will come from Claudia Pesciuta with KNX.
Hi, can you hear me?
Yes.
Oh, okay, great. I didn't hear the beep. Okay, so you mentioned that the board has asked you to weigh in on the possible indoor vaccination requirements. So do you think it should be full or partial vaccination? And what are the factors that'll go into that decision? Also, this morning I talked to Kathy Chedister, who's telling me that hospitals are under strain again. ALS diversion hours are going up, patient offload times are going up. Do you happen to have an update on hospital bed numbers? Like, are we at the point where we have to worry about that again? And then just going back to Ron's question about, kids back to school and how parents feel about it. Like, you have grandkids. Are your grandkids going back to school in person? Do you feel good about that? Like, I think that might be an easy way for people to understand where you stand on this. Thanks.
Yeah, thanks a lot for those questions. In terms of sort of the vaccination requirements at some of our establishments, I mean, the board asked us to look at this, to come back to them with some options. Everybody recognizes by now when we're asked to look at it, we're going to be consulting with labor partners, with workers and worker organizations, and with businesses. And we're going to, have a deliberate set of conversations to really make sure what we're offering back to the board are what they ask for, a set of options, and then for each options, a description of what implementation will look like. I've noted, really for the last few weeks, my gratitude to all of those businesses and establishments that are already layering in additional protections, particularly in those higher risk settings where people are not wearing their face coverings for long periods of time, or where there's very close contact for long periods of time. So I want to acknowledge from a public health perspective, adding in the protections that really have people coming into those establishments that are fully vaccinated makes a lot of sense. But again, we're going to be consulting widely so that we're able to give the board a set of options that really reflects the best thinking that's coming from those in the field, as well as from those of us at public health. And I know there was a meeting, while we're here right now, that we're having with the Hospital Association members to really talk about concerns about the continued rise in hospitalization rates, and the fact that, at this point, it's also reflecting that more people who have tested positive are ending up requiring a hospital care. We always, again, work really closely with our hospital partners and our EMS, agencies to ascertain, what are the steps that we all need to take to be prepared for what might be significant increases still in cases. And again, working sensibly to make sure that we retain our bed capacity and our ability to treat people who need urgent and essential care at the hospitals. To date, no hospitals have indicated that they're facing any significant crisis, and the average bed availability is still sufficient. But we've been here before, where things can change fairly rapidly. I'm grateful that this is a community that's well prepared to make decisions quickly that would allow for decompression at hospitals and make sure that we're not where we were last winter. I frankly don't see us moving to where we were last winter. For many of the cases that get identified through routine screenings, those are asymptomatic people. A larger percentage of them are maybe less likely to go on and develop even mild symptoms, let alone serious illness. So again, while we're seeing, right now, a lot of people who are ending up in the hospital, this mostly reflects that the people who have been getting tested up to now are people who are likely to have symptoms and or a known exposure. So go ahead with the next question on sort of going to school. And my grandkids, yes, they started school yesterday. They actually don't go to school in LA County. They don't live in California. But I want to say, their parents work closely with other parents in the school districts to implement a similar set of safety strategies at schools. And my grandchildren were very, very glad to be able to get back into the classroom. They are, like here, required to wear face coverings all day. And they're required to do their distancing and infection control. And they still reported being thrilled to be able to get back. So, and I think, most parents are hearing that when their children have gone back to school as well. So with that, thanks a million, everyone, for again joining us today, but also for providing all of the residents with really good information about our latest challenges with the surge. And we'll talk with everyone again next week. If we didn't get to your question, as a reminder, just send it over to our communications team and we'll be sure to answer it today.
Thanks, Dr. Ferrer. And that email address, if you don't have it already, is media@ph.lacounty.gov. And we'll begin our Spanish remarks in 3 or 4 minutes, right at 2:30.